think I'm not at any point considering closing the economy back down, but there are certainly levers and options to pull around expanding capacity in healthcare, and the hospitals know that best. I had a long conversation with the board of the Tennessee Hospital Association, who said, we know a lot more about this. We know how to manage this capacity problem much more than we did 4 months ago. Let us work with you to make sure that happens. We want the healthcare systems to, in effect, solve that problem themselves without having to, without the state having to intervene there. And we think they can. They think they can. So I think that's the most important thing, is to continue to watch that. They are higher than they have ever been, but we do, in fact, still have significant capacity in our system prior to engaging in surge capacity. It's very important that we remember that. In fact, we have times in our healthcare system, and you can address this, and why don't you, but we have times in our healthcare system where we're actually much worse capacity shape than we are right now in COVID as a result of flu system and otherwise. You want to add to that comment?
Thank you for bringing that up, and I should have mentioned that in my comments today. In a bad flu season, there might be only 3 or 4 or 5% capacity left. I have personally been in administrative positions in hospitals where we have to take it every 2 or 3 hours at a time and look at our bed count and shift and move. We're nowhere close to that right now. So as the governor mentioned, hospitals are used to doing this. Now, to be clear, nobody likes to be there and nobody wants to be there. It is a strain on everyone. They're pretty adept at doing this, and so we've taken the stance that they know way better than we do on what works for their hospital, and we want to be able to support them in doing that.